Today I'm seeing Mr. G. He's a 36-year-old Hispanic male. He complains of a stable yet persistent dry cough with occasional clear sputum for the last 3 months with nasal congestion. He wonders if he may have allergies. He reports he has night sweats, but he has not taken his temperature, so he's not sure if he's actually running a fever. He feels like he has been fatigued. Family history: he has a history of hypertension and asthma. Medical history for the patient: he does have a history of high blood pressure, which is controlled on lisinopril 20 milligram daily. He does not take any other prescription meds. Social history: he lives with his girlfriend and her 2 children. They have 1 child together. He has a history of smoking, but he quit about 6 months ago. He does work in a hot warehouse. He's been working there for about 3 months and attributes possibly his symptoms to his work there. He smoked about a pack a day since age 16 until quitting 6 months ago. He did have a history of asthma as a child. Subjective review of systems includes that he does admit he has occasionally shortness of breath with exertion. He denies chest pain. He denies nausea, vomiting, diarrhea, constipation, heartburn. He does deny any recent exposure to infections or TB. Objective: his vital signs are weight 180, height 5'11". His temperature is 99.2. Pulse is 72. Respirations are 18. BP is 134/84. On physical exam, objectively, his nasal terminates are gray and boggy. His pharynx is injected with clear postnasal drainage. He has no sinus tenderness or lymphadenopathy. His lungs are clear to auscultation. His heart is regular without murmur, rub, or gallop. His abdomen is soft, non-tender. He has no peripheral edema. The first differential diagnosis would be pneumonia due to the elevation in temperature, the fact that he has had a cough and that it's been going on for 3 months. He does occasionally bring up some sputum, and due to his complaint of night sweats, which sound like he may be having febrile at home and just unaware. The second, and so I feel that pneumonia is likely diagnosis. Although because his lungs on physical exam, his lungs were clear to auscultation. However, pneumonia can't be ruled out. The second diagnosis would be ACE inhibitor-induced cough. I feel this is just as likely as pneumonia due to the fact that the cough is mostly non-productive. The fact that he is on an ACE inhibitor, lisinopril. So that is also a differential diagnosis. And number 3 would be tuberculosis due to the chronic cough, the night sweats. Although this is a little bit less likely because it doesn't show a report of weight loss that he has reported to us, and he has not been exposed to any TB or infectious disease that he is aware of. So references for this have been Ferries 2015, as well as Hippocrates online, which does discuss ACE-induced cough possibly caused by the lisinopril. Additional questions that I would have for the instructor would be as to whether it would be prudent to go ahead and trial him on a different medication for the blood pressure and stop the ACE inhibitor at this time, or whether we should treat the cough first to see if that, with an antibiotic or an antitussive, to see if that's effective before discontinuing his antihypertensive. Additional information that would need to be studied on this would be regarding tuberculosis, whether a TB skin test would be appropriate, or a quantiferon gold test, or a chest x-ray, or all 3. Thank you.